effects of the opioid crisis.
Capitalism has gotten to such a bad state in America that it's not even like wealthy factory owners exploiting the labor of their workers to get rich. I mean, they still do that, but they've outsourced a lot of those jobs to the global south and then just threaten to bomb those countries if they try to raise their minimum wage. But in America, a lot of the wealthiest capitalists are these giant healthcare conglomerates who have commodified our healthcare system. And they've made an absurd amount of money getting people addicted to opioids, particularly in those places where the jobs have been outsourced. And the Republicans aren't going to do anything about it. The Democrats aren't going to do anything about it. Only organized workers can do something about it.
There is a through line from the opioid epidemic and capitalism, but it goes beyond the actual manufacturers of opioids and pain medication. And you know about the Sackler family, you know about Purdue Pharma, and you know about Oxycontin. That was the extremely powerful painkiller that really helped fuel the opioid epidemic in this country. And the Sackler family made billions off the suffering of millions of people in this country. Thousands and thousands of people died as a result. But what you don't see is how that addiction spread to other drugs once regulators clamped down on Oxycontin. But we really need to talk about how these issues are connected. There are a ton of people who got addicted to opioids because they were prescribed pain pills after a surgery, after an accident. And because these things are so powerful, people end up developing a tolerance and ultimately an addiction to them, because it's not just that they need them for their pain, it's that once they slip into withdrawal from suddenly stopping taking them, they really want to take them again just to mitigate the effects of withdrawal. Whether that's body aches, whether that's nausea, extreme sickness, chills. There are a ton of symptoms that are really difficult to manage, and that could affect your daily productivity. I mean, that could affect your job. So for some people, it's easier just to keep taking them than to deal with that withdrawal. And as a consequence, people just keep taking these things and their tolerance gets higher and higher, and they're taking higher and higher doses. Like I said, the Sackler family pushed a lot of this, but so have all of the other pharmaceutical companies that make painkillers, that make opioids. There's a ton of money to be made keeping people addicted to these pills. But then in some cases, what happens if their prescription doesn't get continued or renewed? They turn to things like heroin because it's cheaper and in some cases easier to access. And when you throw fentanyl into the mix, as so many dealers have been cutting heroin with fentanyl, the mortality rate spikes. And I'm sure we all know someone, and I hope you don't, but many of us do know someone who is overdosed because it's so prevalent. And this is where capitalism and addiction intersect, beyond just pushing these drugs for profit. Because of our private healthcare system, it's harder for people to get treatment. We don't have a holistic approach to addiction. People try to criminalize it. Cops throw addicts in jail and just expect them to get better. Our justice system doesn't treat addiction like any other health crisis. And instead of getting care and treatment, people get punished. And we see recidivism rates just continue to increase. People aren't going to get better on their own. Just like any other medical condition, they need treatment. But if you don't have health insurance, and millions of people in this country do not have health insurance, how are you going to pay for costly rehab? How are you going to pay for things like methadone or Suboxone, two drugs that can help you get off of prescription painkillers or heroin? It's just cheaper to keep using and mitigate the effects of the withdrawal instead of paying for rehab. And unfortunately, so many people have to do that, and it just continues this cycle of addiction. If we really want to tackle the opioid crisis, and so many politicians have said they want to, but so few of them have simultaneously advocated for Medicare for all. But that's what we really need to do if we want to tackle it. We need a Medicare for all system in this country now.